know that you can actually shrink fibroid without doing surgery? Oh, now listen up. There are two ways you can shrink fibroid without removing it surgically. Before we go on, I'm going to just explain a little bit of what fibroid is. Because a lot of times we just hear fibroid, fibroid, fibroid without even having the knowledge of what it is. Fibroid is a growth that occurs inside the womb. Now, this growth is non-cancerous. The main cause is not even known. If they ask you now, what causes fibroid? We don't know. The main cause, we don't know, but there are a few things associated with it, but the main cause is not known. But one thing we know is that the reason why this fibroid grows in size quickly is because there is something called estrogen and progesterone hormone fueling its growth. Now, estrogen is a female sex hormone. Progesterone is also a sex hormone. These two hormones are produced by the ovaries inside your womb. These two hormones are produced by the ovary of a woman. In the presence of these two hormones called estrogen and progesterone, fibroid that was small can actually grow bigger or larger in size before you know it. So that's not why we're here today. We're here to know what can we do in the case that we identify that there is fibroid growing in our womb. Now, you might decide to do surgery to remove it. That is in the case where the fibroid has become too large, it's causing a lot of discomfort, you're bleeding excessively during your menstruation, your tummy is growing larger, and the size is becoming too much. I will say remove it surgically. But in a case where the fibroid is small, but you're not comfortable and you want it to shrink, you don't want it to grow in size, you don't want it to keep enlarging, there are two things that can be done. Number one is being placed on a medication that belongs to a group of drugs called gonadotrophin releasing hormone analog. Now, this is medical jargon for those of us who are not medically inclined. But what I want you to know that there is a hormonal management for shrinking fibroid. Now, this hormone is called gonadotrophin releasing hormone analog. What is the function of this medication? It helps to reduce the level of estrogen and progesterone hormone that are produced by your ovaries. So, the period you are taking this medication, the ovary will not produce estrogen. It will reduce the level of estrogen it produces and reduce the level of progesterone it produces. Because I said earlier that in the presence of these two hormones, which are estrogen and progesterone that the ovary produces, fibroid can grow larger before you know it. So if we can tackle the fueling factor, what makes the fibroid grow larger, if we can tackle it, if we can reduce the level of what fuels the growth of this fibroid, then the fibroid will begin to shrink when it does not see its fueling power anymore. Do you understand? So this medication belongs to a group of drugs called gonadotrophin releasing hormone analog. You will take it in form of an injection, or you can take it as a tablet. You will take this medication as an injection for the period of 6 to 9 months. Now, mind you, I'm not saying that after 9 months, the fibroid will disappear. It only helps to shrink the fibroid by reducing the fueling factors or what makes the fibroid grow. It reduces the level of those things which are your female hormones, estrogen and progesterone. As soon as it starves the fibroid of these hormones, the fibroid will begin to shrink in size. After the period of 6 to 9 months, if you stop this medication, the fibroid has a tendency of growing again, but this time around, it's not going to grow rapidly. Of course, you have reduced the level of your hormones so low that it doesn't have the ability to just fuel the growth immediately. So the fibroid will now start growing slowly. So it therefore means that you have to take this medication for a longer period of time until the fibroid shrinks to the point that it is insignificant. That's one way. And mind you, it is not available in a pharmacy where you can just walk in. I want to buy gonadotrophin releasing hormone analog because I've told you the name. No, ma, no, sir. You will go to a hospital and you'll be checked by a gynecologist. You will tell them your problem and you will go for a scan. They'll send you for a scan. As soon as they discover that there's fibroid, they will look at where the fibroid is located, the size of the fibroid, and choose what method of removal will be suitable for you. I'm just giving you this information so that for those of you out there who has been confused and thinking, how do I get rid of this fibroid? It is not only by surgery that you can remove a fibroid. There is a medical way, which is taking this hormonal medication, which is called gonadotropin releasing hormone analog, in the form of an injection for 6 to 9 months or as tablets. The second method of shrinking fibroid, it's called fibroid artery embolization. Hello? Fibroid artery embolization. It is still a medical jargon, so don't mind me. Your concentration should be what it is all about. Now, in this case, this will be done in the hospital by a radiologist in an X-ray department. You cannot go today and come back that same day. So you bear in mind that if you're going for that procedure, you're going to sleep overnight because you need to be observed. What happens is this: the radiologist or the doctor who is actually going to do this for you will insert a tube that is called a catheter. He will pass that tube through your groin. When I talk about the groin, everybody look down below around your waist. You know the V-shaped curve that leads into your VJ. Around that area is called the groin. So a tiny tube called a catheter will be inserted around that groin. This catheter is inserted through the artery in your groin. It will also be inserted into the artery in your womb that connects with the fibroid. Now, after they've inserted this catheter into those arteries, there is a substance that will be injected into this catheter. Remember, this catheter is like a tube. It has like a pipe, okay? So you can see through it, something can be injected into it. A certain fluid or chemical will be injected into this catheter. The essence of injecting this fluid or this substance into this catheter is to block the artery that is supplying that fibroid. You know, because when there is an artery supplying blood to that fibroid, it's giving the fibroid nutrient. It's just like a fibroid is a baby there. So, of course, it has blood flow coming. Of course, there is hormone influence. Of course, a lot of things will continue to feed it for it to grow. So, we are just trying to starve the things that feed the fibroid to grow, thereby shrinking the fibroid in size. So, as soon as this substance is injected through the catheter, it will just block the blood flow of blood from that artery to the fibroid, thereby starving the fibroid and shrinking it. Just like a human being, if you don't eat for days, months, weeks, you will start looking shrunken. You will start looking malnourished. Your body will start depreciating. That's the same thing. If there are no hormone influence, which is the estrogen and progesterone, that is in the case where I said you can take medication called gonadotropin releasing, hormone analog. The fibroid will shrink. Now, in this case of fibroid artery embolization, we are putting a catheter, injecting a certain substance into that catheter to block blood flow from your uterine artery to the fibroid, thereby making it malnourished, thereby making it to shrink, or lacking the essential nutrients for it to grow, it will begin to shrink. Is that understood? Meanwhile, these two things cannot occur at home. I'm not saying walk to a pharmacy and ask them you want to buy this or that. It has to be done in an environment in a controlled environment, in a hospital setting, and you'll be evaluated, you'll be reviewed by the gynecologist or whoever is going to do this procedure and deemed fit. The side effects and everything will be discussed with you before it is done. I am just here to give you the information that there is a way out. Remember to subscribe to my YouTube channel, as I'm going to be dishing out more useful information on this platform. Until next time, I remain as ID on Facebook and on YouTube. Take care. Bye-bye.